Well, Dr. Joanne Jenkins, congratulations first on your honorary degree from Washington College this past weekend.
Well, thank you so much. I was honored to receive it.
Now, you're a native of Mobile, correct?
I am. I grew up down on Fowl River, down in Bellefontaine, Alabama.
Where did you go to school?
I went to high school at Theodore High School and middle school at St. Elmo.
Wow. And then you graduated from Spring Hill College.
Graduated from Spring Hill College in 1980.
All right. Well, a lot of things have changed since you graduated from college. I graduated from college. We're seeing people 65 and older are soon going to outnumber kids who are under 5 for the first time ever. What kind of challenge does that place on America in general? How are we going to support all of these people, the baby boomers who are now hitting retirement age and beyond?
Well, we see it really as a great opportunity for people who are 65 and older, and really 50 and older in this country. You know, most of our 38 million members at AARP, 40% of those are no longer retired. They're still working in the workforce. And so it creates, you know, a whole opportunity for people who are 50 and older in this country to keep engaged, to continue to find purpose in their life. And the work that we're doing here at AARP, we hope are going to help them prepare to stay in the workplace longer, and also prepare to engage with that intergenerational kind of work environment.
So you're seeing a time where people traditionally used to retire at 62 or 65 or 66, and now financially they may have to keep working for years beyond that.
Yes. I think well, even in our own lives, I think that we see that not only do many people still have to work after they are older than 62, but a lot of us still want to work beyond that age period. You know, a person born today is likely to live with good health until well in their 80s or 90s. So you think about that's a number of years working past the age of 50 that they're going to be in the workplace. And I think we see so many different trends of bringing additional educational kind of experience and work ethics to the workplace. And I think the opportunity for us at AARP is to help our members stay engaged and stay abreast of the technology and the different kind of work environments that they're coming into the workforce now.
I think a lot of people equated youth with being vital to the workforce, and being, say, over 50 is like 1 foot in the grave. That's certainly not the case anymore.
Oh, absolutely not. I know that for my own self, I came here to AARP 4 years ago, and I can't imagine that I want to retire. It's an exciting time. I think most people, after they're having their kids either graduate or leave home, they're finding an enormous amount of time on their hands that they want to give back, either in the workplace or doing community service work or volunteerism, and really finding real meaning and purpose in their lives. And so there is this whole time period of, you know, anywhere from 20 to 30 years that people have to give back to this country. And so we're hoping that the work that we're doing at AARP is going to engage them and keep them involved in the community, or keep them involved in the work environment, and we see that as a good thing.
And part of the challenge as people get older is, of course, health care. We have Obamacare here. Some people like it, some people don't. What part do you see health care playing, and AARP's part in it, in keeping people who are getting older healthier?
Well, certainly one of the things that we've been focusing on here at AARP is, you know, to try to bring down the cost of health care, but also to make sure that every American has access to good quality health care. And that's so important in our society, that we're really trying to make sure that as you live longer, you're also living healthy. So a lot of our work is focused on how do we provide health care access to people all over this country who are 50 and older, and it's certainly going to be a continued focus here at AARP.
And a lot of people would traditionally go to the doctor only when they got sick, but there's a better way to deal with health care than just that.
Well, certainly. I mean, I think you see a lot of wellness programs. We know that the more active and engaged you are, not only in your personal life but in the community, you're more healthier person. We also know for the work that we do with AARP Foundation that when you're isolated and alone, that you're more likely to have suffer from health consequences like diabetes and high blood pressure and overweight. We certainly think it's important for all of our members, not just AARP members, but really Americans 50 plus all over this country, to be engaged, to live healthier lives, to eat healthy and be physically fit, and it all attributes to being a happier and healthier person.
How has the mission of AARP changed over the years? It used to be the American Association of Retired Persons, now just called AARP, is that right?
Yes. So really, we are still focused on helping those have a financial retirement. But as I said earlier, that 40% of our 38 million members are still in the are no longer retired. But AARP is really focused on trying to be the trusted ally for people who are 50 and older in this country, and helping them to meet their everyday needs, and really creating real possibilities in their lives. And so that's the work that we're focused on, and that's what we think that the American people want us to do here at AARP.
Joanne Jenkins, thank you so much for joining us today.
Thank you, Bob.